AIDS stands for Acquired Immunodeficiency Syndrome. It is a condition that severely impacts the body's ability to fight off infections and diseases. This syndrome is the final stage of HIV infection where the immune system is badly damaged. It is a serious condition caused by the human immunodeficiency virus, or HIV. HIV is a virus that targets and gradually destroys the immune system, which is our body's natural defense against illness. This virus attacks the body's immune system, which is our defense system against infections. The immune system is made up of various cells and organs that work together to protect us from harmful pathogens. The immune system is like an army that protects us from germs. Just as an army defends a country from invaders, the immune system defends our body from bacteria, viruses, and other harmful organisms. HIV weakens this army, making it easier to get sick. When the immune system is compromised, the body becomes vulnerable to a wide range of infections and diseases that it would normally be able to fight off. When HIV weakens the immune system, it can lead to AIDS. AIDS is the most severe phase of HIV infection, characterized by a very low count of certain immune cells and the occurrence of specific serious illnesses. People with AIDS are more likely to get opportunistic infections. These are infections that take advantage of the weakened immune system and can cause severe health problems. These infections are called opportunistic because they take advantage of a weakened immune system. They can be caused by bacteria, viruses, fungi, or parasites that are normally kept in check by a healthy immune system. Understanding how HIV affects the body is the first step in understanding why coughing can be a serious issue for people with AIDS. When the immune system is weakened, even common respiratory infections can become life-threatening. Coughing itself is not a direct result of HIV. Instead, it's a symptom of other infections that people with weakened immune systems are more susceptible to. Think of your body as a fortress. A healthy immune system is like strong walls and vigilant guards, keeping invaders out. HIV weakens those walls and distracts the guards. This allows opportunistic infections, like those affecting the respiratory system, to enter more easily. These infections are the real reason behind the cough. Therefore, it's crucial to pay attention to a cough, especially in the context of HIV/AIDS, as it could be a sign of a more serious underlying condition. People with HIV/AIDS are prone to a range of respiratory infections. These infections can be more severe and harder to treat due to the weakened immune system. One common infection is pneumonia, which affects the lungs. It can cause coughing, fever, and difficulty breathing. Another serious one is tuberculosis, or TB. TB is a bacterial infection that primarily affects the lungs and can be life-threatening for people with HIV. Other infections like bronchitis and sinusitis are also more frequent and severe in individuals with compromised immunity. Recognizing these infections and seeking timely medical care is essential for effective management and better health outcomes. A persistent cough, particularly in someone with HIV/AIDS, should never be ignored. It can be an early warning sign of a respiratory infection. Doctors use various methods to diagnose the cause of a cough. A physical exam, medical history, and tests help pinpoint the culprit. Chest X-rays can reveal lung infections, while sputum tests analyze coughed-up mucus for bacteria or fungi. Blood tests are crucial for monitoring the immune system's strength and guiding treatment decisions. Early diagnosis is vital for initiating appropriate treatment and preventing complications from setting in. Section 5. Treatment options for HIV/AIDS and respiratory infections. While there is no cure for HIV/AIDS, antiretroviral therapy, often called RT, is highly effective in managing the virus. RT suppresses HIV replication, strengthens the immune system, and reduces the risk of opportunistic infections. Treatment for respiratory infections depends on the specific cause. Antibiotics are used for bacterial infections like pneumonia, while antiviral medications can treat certain viral infections. In severe cases, hospitalization may be necessary to provide respiratory support and intensive care. Adhering to the prescribed medications and treatment plans is crucial for effectively managing both HIV/AIDS and any associated respiratory infections. Section 6. Prevention is key. Protecting yourself from HIV and respiratory infections. Preventing HIV and respiratory infections involves a multi-pronged approach. Practicing safe sex, using condoms consistently, and ensuring that both partners are aware of their HIV status are fundamental steps. It's important to communicate openly with your partner about sexual health and to get tested together. Avoiding the sharing of needles is another critical aspect of HIV prevention. If you use injectable drugs, always use a clean needle and never share it with others. Many communities offer needle exchange programs to help reduce the risk of HIV transmission. Regular HIV testing is essential for knowing your status and taking appropriate actions. Early detection through testing can lead to timely treatment, which not only improves health outcomes but also reduces the risk of transmitting the virus to others. Early diagnosis allows for timely treatment and prevents transmission. Antiretroviral therapy, ART, can help manage HIV effectively, enabling individuals to lead healthy lives and significantly lowering the chances of passing the virus to others. For respiratory infections, good hygiene practices are paramount. Washing hands frequently with soap and water is one of the simplest yet most effective ways to prevent the spread of infections. Hand sanitizers can be used when soap and water are not available. Covering your mouth and nose with a tissue or your elbow when you cough or sneeze helps prevent the spread of germs. Dispose of tissues immediately and wash your hands afterward to maintain hygiene. Avoiding close contact with individuals who are sick is another effective measure. If you are caring for someone who is ill, take precautions such as wearing a mask and washing your hands frequently to protect yourself. Vaccinations are also available for some respiratory infections, such as pneumonia and influenza. These vaccines are highly effective in preventing severe illness and complications. Vaccines for pneumonia and influenza are particularly important for vulnerable populations, including the elderly, young children, and those with chronic health conditions. People living with HIV/AIDS are especially encouraged to get vaccinated against respiratory infections. These vaccinations can help prevent complications and improve overall health outcomes. Always consult with your healthcare provider to stay updated on recommended vaccines and other preventive measures. Section 7. Managing your symptoms, practical tips for relief. While seeking medical attention is crucial, there are things you can do at home to manage cough and respiratory symptoms. These practical tips can help alleviate discomfort and support your recovery process. Staying hydrated by drinking plenty of fluids helps thin mucus and makes it easier to cough up. Water, herbal teas, and broths are excellent choices. Avoid caffeinated and alcoholic beverages as they can lead to dehydration. Using a humidifier or taking a hot shower can add moisture to the air and soothe irritated airways. The steam helps to loosen mucus and can provide immediate relief from congestion and coughing. Rest is essential for your body to fight off infections. Ensure you get plenty of sleep and take naps if needed. Your body needs energy to heal, and rest can significantly speed up the recovery process. Avoid smoking and exposure to secondhand smoke, as it irritates the lungs and worsens respiratory problems. If you smoke, consider seeking help to quit, as smoking can severely impact your respiratory health. Over-the-counter cough suppressants can provide temporary relief, but it's best to consult a doctor before using them, especially if the cough persists or worsens. Your doctor can recommend the most appropriate treatment based on your specific symptoms and medical history. Saline nasal sprays can also be beneficial in keeping your nasal passages moist and reducing congestion. They are safe to use and can be found at most pharmacies. Eating warm, nutritious meals like chicken soup can provide comfort and essential nutrients to support your immune system. Warm liquids can also help soothe a sore throat and keep you hydrated. Practicing deep breathing exercises can help improve lung function and reduce stress. Find a quiet place, sit comfortably, and take slow, deep breaths to help open up your airways and relax your body. Lastly, maintaining good hygiene by washing your hands frequently can prevent the spread of infections. Use soap and water and wash for at least 20 seconds to ensure your hands are clean. By following these practical tips, you can manage your symptoms more effectively and support your body's natural healing process. Always remember to consult with a healthcare professional for personalized advice and treatment. Section 8. Seeking help. The importance of early diagnosis and treatment. Early diagnosis and treatment are vital for effectively managing both HIV/AIDS and respiratory infections. If you experience a persistent cough, especially if you have HIV/AIDS or suspect you might, see a doctor immediately. Don't delay seeking medical attention, as early intervention can significantly impact treatment success and long-term health outcomes. Remember, knowledge is power. Understanding the link between HIV/AIDS and coughing, recognizing the symptoms, and taking preventive measures can empower you to protect your health. Section 9. Conclusion: living a healthy life with HIV/AIDS. Living with HIV/AIDS requires ongoing management and care, but it doesn't mean a life without quality. By taking antiretroviral therapy as prescribed, adopting a healthy lifestyle, and being proactive about your health, you can live a long and fulfilling life. Regular medical checkups, open communication with your healthcare provider, and a strong support system are essential for navigating the challenges of HIV/AIDS. Remember, you are not alone. With the right knowledge, resources, and support, you can live a healthy and meaningful life despite the challenges of HIV/AIDS.